We wanted to ensure that we have equitable access to earwax and hearing health services across South West London.
The current wait into hospital to have earwax removal is nearing that 18-week treatment target. That's a long time.
I think everyone knew that there was a massive gap in the ENT services and the increased demand on GPs and secondary care.
Pilot was trying to learn and achieve whether it was even possible to remove this secondary care burden around earwax and basic hearing screening back into the community.
We have been pushing really hard to be able to show the value of what our teams can deliver and how a pharmacy can be used as the proper environment for healthcare delivery.
With this pilot, it's very much the first of its kind, setting up a brand new service in a brand new arena. So one of the key things that you need is identifying not only the people, but the skill mix that you need to help formulate a robust task and finish our project team.
Out of that task and finish group was born a number of work streams that looked at, like I said, quality and governance, that looked at IT, that looked at delivery and meeting the KPIs, and that looked at having oversight of a program to ensure that the people that are delivering are feeling well supported and confident enough to deliver.
It was very fast. I think within 3 to 4 months it was all up and running. So after training you had the supervisor from Tympa come, assess us, accredit us, and that was it. We were good to go from there.
It requires an incredible amount of collaboration between different stakeholders which transcend those traditional boundaries. We're not working in silos of primary care and secondary care. We're working as a healthcare system.
I also provide a MDT approach, which is like a monthly meeting with a group of the pharmacists and where we can get together.
You engage with all the people that are on the pilot, not just the people within our company, but also the entirety of the LPC group that is running this trial. As a result of that, you can pick up bits of feedback from everyone.
By having a place where you could go and talk about those scenarios and get, a really great professional answer on what to do next time, has made a huge amount of difference to our practice.
I think the pharmacy sites as well, they've been so dedicated to the service.
With the Tympa system, you see that you get an immediate impact, and it is really satisfying to see patients literally jump up and they go, oh, I can hear again,
For many, many years, pharmacy was just about dispense the medication, hand it out in a bag, job done. But what we're seeing over the last few years is a lot more services come in, and us as pharmacies being able to provide a lot more and really showing how much potential we have from a clinical perspective.
And I think that's the key here, is how can we best present ourselves as pharmacists to the world and say, look, we can do a lot of this stuff for you, just give us the opportunity to do it.
Just between the 20 pharmacies that I know of in our pilot, if each of them are doing about 500 removals in the past 11 months, imagine how much hospital time that frees up. It's huge.
Now, for some of ththese patients, they've been seen by the community pharmacy and discharged straight back to their GP without any further input needed. That's about 74% of patients that's happened to, which is really impressive.
This pilot with TympaHealth has really shown that pharmacy can be used as a clinical setting for interventions that take a patient outside of what was previously seen as a shop environment and now a clinical environment into a consultation room and feel just as looked after as they would do in a hospital or a GP practice.
So having that service that potentially can often see people within a 2-week time frame, or even the worst case scenario 2 to 4 weeks, is a massive improvement.
The pilot has shown how if you do use more innovative digital technology solutions, that you can provide a more in-depth service for patients, but not compromising on quality and safety.
Going to a GP practice, going to a hospital can be quite scary. Using technology means that takes a lot of that barriers away, and therefore hopefully ease their access and improve their general health. If you improve their general health, you improve their economic worth, they work and live longer.
Digital healthcare solutions mean that you can have the intervention you need, where you want it, how you want it, and you can ensure that care follows the patient.